Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
More than 25%, more than 25% of the American population have dental caries, and they don't do anything about it. They talk about the importance of flossing and taking good care of your teeth because they are often a source of infection that is unrecognized. And so it's an important aspect of our health that we don't often talk too much about, but we should.
What does caries mean?
It means that you have holes in your teeth that are sources of infection. Dental caries, little holes that allow bacteria to get in and cause infections and cause other diseases.
Are caries the same as cavities?
Yeah.
They also had on Facebook regularly now warning women against putting perms in their hair because it's causing cancer, breast cancer, and cervical cancer. So I see it a lot on Facebook. So
Well, Facebook is not the Bible, so.
I know, but we had brought that article up before to warn women against getting perms.
Right, but not
Those
that
chemicals.
it caused breast cancer, though. That's what said cancer, but what didn't specify.
Oh,
I
so
think
that's
a good article for us to talk about the next time was the perms and how they we talked about it before, but we talk about it again how they affect you. They cause a lot of bad things. Of course, how long have we been using perms? Women been using perms. How long?
Since I was in my 20s. That's like
Long enough.
50 years.
Long enough to give American Black women the highest rate of breast cancer in the world.
Haven't bothered me so far.
Okay. We're ready, John Buchanan, to start. A number of articles that are very interesting. Something going on new every day in the world. This is an article that actually we talked about it before, but this is the most recent article that talks about the fact that music improves mental health as much as exercise. And of course, we talked about exercise all the time. We don't often equate the benefit of music to mental health as we talk about exercise, how it's good for your mental health and all that. But we don't often recognize how important it is to have music and how that improves so many things. Same things that exercise improves: sleep, self-esteem, and mood, and talks about board certified music therapist. And I didn't know there was such a category. And most of us on this call are musicians. So it's interesting to see how it is helping our own mental health involving with in music.
Dr. Callender, I have a close friend, Victoria, who's a harpist, who is a music therapist at Children's National Medical Center. And so that's been her full-time job for maybe 10 years or so. It's and she came up to the hospital for after my mom had her stroke, and it was amazing the effect that the music had. Her playing the harp in the hospital room, it was amazing. I mean, we were ready to send her to hospice, and like the next day, right after this therapy, she was in really good spirits and bounced back. It was amazing.
Yeah, the harp is an interesting instrument because it's not played by that many, but it's a beautiful instrument. I don't know that many harpists though, as you mentioned it, and I don't know many.
Well, in a lot of ways, a guitar is just a small harp.
Well, doesn't sound like one. No.
If you play it correctly, I mean, if you play it finger style, the way harp is played, it can mimic the sound of a harp very much. If it's picked, played like rock and roll, yeah, it's not a harp. But played like classical guitar style, finger style, very
Oh
much
yeah,
mimic a harp.
yeah, that's a beautiful sound. That and the piano, but the harp seems to be more angelic than anything else.
Piano is a harp in a way.
Yeah, yeah,
You look in the shape of the inside of a piano, it's shaped like a harp.
yeah, it is. Sure is.
John Buchanan, what was her name again?
Victoria
Payton.
Victoria Payton Weber.
Yep.
Okay, she's not the one. We have a harpist that tunes our piano. I was just wondering. That's not her.
He knows her too, Carol. Yeah, John Buchanan. What is her name, Carol? She's
Yeah.
very popular.
She tunes harps.
Yeah, I know who you're talking about. I see her
Yeah.
face. She plays
Uh-huh.
she plays at Asbury too.
Right.
She plays the harp at
Uh-huh.
Uh-huh. One of the few churches that are higher. And she'll go for that.
Name Kim comes to mind. Kim something. Kim Sater.
Seder. That's right.
Seder, yeah. Now that we all think of it. How long did it take us?
Is there a type of music that's better for you than others?
whatever music that that you're used to is probably good for you. Whether because I think a lot of it goes back to what you grew up with and brings good memories to you. So whatever music that some people like rock and roll, they like all other kinds. I think it depends upon your own musical history.
But there is one type that the medical music therapist said that is detrimental, and that's heavy metal.
Yeah, yeah, yeah. Well,
That
they deaf as well.
That has also caused illnesses and heart attacks and adrenaline. And they said even for children or young adults that listen to that, they have more health deficits than other people. So that's one type of music because of the rhythm and the thumping and the beat and etc. makes it detrimental to one's health.
And the volume.
And the
Yeah,
volume.
it probably make you deaf as well.
Yeah, some of them commit suicide.
Well, on another point, good morning, everyone.
Good-
Dr. Callender, as a teacher, with kids coming from all different backgrounds, and I've always taught them that when you enter the classroom, leave all the things that are not nice outside the door. And I always played Beethoven and Mozart all throughout the day, and and I did it for 20 years. So the transformation that I would see, the change in the kids from when they enter the room and when they sit down to do their warm up, and the transformation of their mental state was just outstanding. And so I utilize that a lot.
Great. This article is on the higher sense of purpose in life, showing that it's linked to lower mortality risk, which is not surprising to any of us because we all have a purpose. And it implies that those who don't have a purpose have a lower risk of, have a higher risk of death. And of course, this is interesting because they did this study among 13,000 people who were 50 and older. It makes you wonder what would the risk be done in younger people. But people with the highest sense of purpose indicated the lowest risk of death, with the highest mortality, they had no sense of purpose. And I guess it's not surprising to us, but it's another evidence that purposeful life makes all the difference. You know, I think of Carol, because she always giving of herself, and sometimes we forget that it's in giving that you receive. Pardon your pardon is dying, you go into eternal life, and so that having a purpose and being a very giving person it leads to longevity.
Dr. Callender, I
Yeah.
have a friend and she noticed that her children, well, particularly this one child that's married with children, has no purpose and they're just has succumbed to living this mediocre life. What could she possibly do? She knows they don't have a purpose. They probably know they don't have a purpose. So what is saying you need a purpose in life so you can live longer? What can you do to motivate them to have a purpose?
I don't know. Anybody have any thoughts? Because different strokes for different folks, and I don't know what particularly would motivate them if they have no motivation at all. Any thoughts on the panel?
Some happy music.
You know, it's just like someone that's on drugs and say, you shouldn't be on drugs. Yeah, duh. Like telling someone you have no purpose in life, so your life is going. I mean, having this knowledge, what can we do with it?
Well, I think that what we've already done with it is that most of us have a purpose, and maybe that's the reason we're on this program, because we know we have a purpose. Those who have no purpose, how do you get them to develop a purpose? It's I think you have to know their history and try to understand why they have no purpose. I think most of us are surrounded with people who have a purpose, and so understanding why someone does not have a purpose probably is helpful in terms of trying to give them a purpose. But I don't know the answer to that question. It's a great question, but I don't know I personally don't know the answer, because I've had a purpose all my life, and so all I do is talk about how being purposeful has been beneficial to me, but that is something that's very personal, and I don't know how to address it.
Dr. Callender, in teaching, my experience, it's like filling up an empty glass with water. If that glass is empty, you one drop at a time would increase it to the top of the level. So like with my students and people I work with, you start with a small drop and you steady keep encouraging them. It's just like, for one example, quickly, it's just like with my own 3 kids. When they were very small, I kept saying, well, you know, you're going to have to go to college to make it in this world. The competition is strong. You're going to have to make it in college. Now, when they got to junior high, I said, well, you know, that BS is not going to stop you. You got to have a master. And so with my students, I did, there's a song that I see you in the future. Okay, so before that song came out, I used to play a game with all your beautiful personality, all your talent. This is what I see you in the future doing. And they would love it. They would love it. And they said, don't forget about me. Don't forget about me. Tell me, Ms. Dorsch. Tell me, Ms. Dorsch. And so that was just my encouragement to them. One drop at a time.
Any other thoughts in terms of addressing Carol's question?
I think that's a lot of the parents' responsibility. I think you have to start early. And if you're a person who has a purpose, it kind of rubs off on your children as they grow.
And some say that if you haven't done it by the age of 9, it's not going to be done.
Right.
So that the role of the parents becomes
Mhm.
magnified.
Yes.
Dr. Callender, I think that doctors and nurses have a high purpose.
Yes, they do.
Yeah, but they usually begin that early on in life.
Yeah, but so do teachers.
Yeah,
Don't leave them out.
right.
Yeah.
Yeah. Yeah. And parents.
So what you're doing, you're setting a precedent that's not completely good for us. Saying, like teachers used to, I heard them saying, you're not going to be anything but slinging French fries and say, what do you want with your burger fries? Which they lower the esteem of working, that having working at McDonald's is nowhere when the world of work is somewhere. So you're saying that someone that chooses to be a mechanic has no motivation or something like that. You're
That's the
what I'm
purpose.
trying to say. Huh?
But that's the purpose. Mechanics is the purpose.
A purpose or a beautician, but you know what we really used to do is just hold certain positions as being successful. You could be a custodian and that's your purpose in life, to clean the best way you can.
Mhm.
You're setting
Right,
up
God has a
something.
purpose for all of us. So the question is, what is God's purpose for you? And that person, that's an individual question that has to be answered by the individual as they are responsive to God. But if they don't believe in God, for example, and they're atheist or agnostic, then often the die is set. And so sometimes an example, your life as an example may be motivating, but sometimes it's not. So the earlier you can help with the development of a purpose, the better off you are. The later you develop it, the less privileged you are, I think. But
And also your mental capacity. There are some people who are not mentally able to perform those higher level jobs, and those jobs of flipping hamburgers and custodial work is perfect for them.
it's perfect for anyone who feels it's perfect for them, because we all
That's
have
true too.
we all have different
That is true.
purposes. Yeah. We have different
And
gifts, and we all have to use the gifts as we're given them. To whom much is given, much is expected.
And you really never know, because I had a classmate back in the 60s who started working at McDonald's flipping hamburgers. And at our 50th class reunion, he's big top executive at McDonald's, and he sponsored the whole reunion for us. So you never
Yeah,
know.
you're right. It's up to you. You know, it's
That's
all
it.
up to you. And I think having a purpose helps you understand that you just do the best that you can do at whatever you do.
Whatever.
Right. And a
Whatever
lot of times it's exposure and involvement. And as someone said earlier, it starts in your child. And if mom and dad lets you sit all day and watch TV, you know, will they have that purpose? Will they have that drive? But get them away from the TV, expose them to different things, activities, whether it's in school or out of school. I think it's exposure.
Well, we've had a good discussion. So moving on to the next, we've talked about intermittent fasting, and as a solution to gastroesophageal reflux disease, which is a common problem. And many millions of dollars are spent on medications. But one of the cheapest solutions may be intermittent fasting. Of course, proton pump inhibitor therapy is probably the most commonly used medication. But anyway, they're suggesting that intermittent fasting may be as good as the PPIs, which is the term they use for proton pump inhibitors, which is really, for most people, they consider that a treatment of choice for gastroesophageal reflux disease. And this tries to explain why fewer meals results in improvement in the pH of gastroesophageal reflux disease. Many of you have that on this call. I think it's a common disease that's not uncommon to find, but most people are on medication for it. I don't know anybody who's used this particular treatment of intermittent fasting to resolve that.
I have it.
Sometimes people call that giving your GI tract a rest,
Yeah,
take a break.
yeah, that's what we do say. And that may be part of the reason it's helpful.
And my thought on it is about that would be the opposite thing to do, because when you're hungry, it seems like the digestive juices flow into your stomach, and if there's no food in there, that seems like it could start eating your stomach. I don't know. I have it. It's very uncomfortable sometimes. And I take medication for it, been taking it for years. But I've also heard that the one that I was taking could have an effect on your kidneys or your liver. So my doctor had me stop be on it for 2 weeks and then off for 2 weeks. Then my new doctor took me off of Prilosec, omeprazole, and put me on a different one, famotidine, something like that. But we'll see.
Any other thoughts? Okay, next one. Now, this is an interesting article which talks about the first ever agent to delay type 1 diabetes. As we mentioned before, the type 1 diabetes, when your pancreas does not have insulin, your beta cells do not produce insulin. And so in that situation, you have to have insulin from outside of the body. And so they're talking about that there are people who develop type 1 diabetes later on in life. And there are ways of doing C-peptide tests and other tests to find out if you're likely to fall into that category. And this medication delays apparently the onset of type 1 diabetes. And they found that taking this medication may delay the onset of diabetes by as long as 2 years. And so this is a new drug, but it's only applicable to those people who have not yet developed type 1 diabetes, but have demonstrated the likelihood that they are going to develop type 1 diabetes. And often this is teenagers and people who are youngsters. And this is a study that talked about, they compared it to placebo, and they identified that the C-peptide is the test that they use to determine whether your pancreas is capable of excreting insulin. If your C-peptide is 0, then you've got type 1 diabetes. But if it's low and you're likely to develop it, then this is the category that you would fall into. And this is the article that further talks about a sister who had bad diabetes, and she got tested and was found to have likelihood of developing it. And of course, this look at the cost of the medication. That would almost cause diabetes, the cost of the medication. Can you imagine? Yeah. And of course, we talked in early, previous, maybe a month or two, about the fact that the price of insulin is so expensive that many people are rationing insulin. And so we've got many problems with paying for the insulin itself. So really an ounce of flesh is worth a pound of cure. But even this medication is very expensive.
So, Dr. Callender, what is the benefit of delaying something like this for a year or 2 years? I mean, when it's going to come anyway? I don't understand.
Well, I guess insulin is something that you have to inject every day. So delaying it for any period of time is probably desirable. That's all I can say. You also, I think it's, if you can delay it for 2 years, that would be desirable. But the long term, I think if you're going to get it anyway, it's still problematic. Diabetes is diabetes, and it has many negative effects. It's not like it completely delays the onset of diabetes. It just delays it for a year or two. Hopefully, in the meantime, we find another medication that actually will prevent you from developing it itself. So maybe in the 2 years, maybe we'll find something else. That's the only thing I can say, because if 2 years from now you still have to get diabetes, it's not a good disease, not a fun disease. You learn how to live with it because you have to. But taking insulin is not fun either. But who can afford to pay for this medication they're talking about?
Yeah. John Tatum, you had diabetes, but
That's a different type of diabetes, because that's diabetes that's caused by steroids, which is short lasting. Whereas the diabetes that they're talking about is permanent. So there's some diabetes that's more like type 2 diabetes. That's caused by taking medication. As soon as you stop the medication, the diabetes goes away, and which is different from type 1 diabetes. Once you got type 1, you've got it. And that means your pancreas is not secreting insulin. So type 2 diabetes is a little different from type 1 because type 2 can be overcome often just by exercising and losing weight, whereas type 1, that's not going to help.
Thank you.
Now, this is the new dominant. BA5 is no longer dominant. That's the new dominant BQ and B1, and there's another name for it. We'll see later on. But the old variants are, as someone had said long ago, as the virus changes, you get new developing variants. And so it's going. That's what we're seeing again. And this is why it's expected that we will probably wind up having to take a vaccine for coronavirus at least once a year, maybe every 6 months, because of the variations of the virus.
Dr. Callender, this is Sylvia. So when the COVID vaccine, is okay, let's say it's developed, and then there's another variant, another variant, and another variant. How do they well they you start with the base and then you add something on to deal with the second variant and the third variant? And how does that work?
Yeah, well, as they identify the genetic anatomy of the change in the virus, they then develop antibodies to those variants. And these antibodies are the so-called vaccines that now address or cover those variants. So as they identify the variant, they then try to develop antibodies to the variant. And so the vaccine that you would get would be one that has specific antibodies to the variant, just like the most recent boosters. They were developed, and they are particularly effective against the variant that was previously there. But now we have new variants, so that means down the road we probably have to have another vaccine for that.
Good Lord. Okay, thank you.
But as you think of the flu, that's been happening every year.
Mhm.
That's
But
happened
are there
every year.
different levels of I guess you're saying because there's different levels of the flu?
Well, no, every year we have a different vaccine for the flu because there's a variant of the flu. So that's already been happening every year for us with the flu. What we're
Oh.
seeing with the coronavirus is the same thing that we've seen with the flu since
Uh-huh.
1918, which is 100 years ago. And
Oh, I see.
so now we're going to see the same thing with the coronavirus.
Oh, I see. Okay, thank you.
Now, this is an article that talks about the benefit of having full vaccination. As you know, initial vaccination was 2, and then we've had 3 additional boosters since then. And so to be up to date, you'd have to have 5 vaccine injections. And they're saying that in order to be fully protected, you need to have all of those boosters. And there's evidence that having all of those boosters prepares you better than just having 2 or 3 of those.
Dr. Callender, I have a question. When they are creating these variants, these antibodies to the variant, are they working on the level of molecules when they try to create these?
Yes.
Are they also working on they're working on molecules, but what about atoms and subatomic issues? Are they working there too as well?
Yes.
That was Dr. Beto's specialty for his doctorate degree, molecular genetics.
Mm-hmm.
I just have a hard time even pronouncing it, but
yeah, well, it's interesting how we have attacked the gene, and the gene is made up of all of the proteins, and so they're at that subatomic level where they look at the different proteins and identify the changes in the proteins. And that's what the antibodies address, the changes in the proteins. This is an article I think is very important that cancer diagnoses lag because screenings have fallen off during the pandemic. And there's evidence that this article shows that breast cancer screenings fallen by 40%, cervical cancer by 36%, colorectal cancer by 45%. Which means that people are going to get later diagnosis. Get later diagnosis, the disease is less likely to be cured. So screening is one of the most important things we can do. But because of the pandemic, people have stopped screening as much as they used to. Not only is the cancer screening down, but also primary care and non-mental health issues has fallen as well. So it's going to have an impact of hypertension and diabetes and other things as well. So what the article is begging is people to go back to their pre-pandemic health practices, get their screenings for cancer as well as other things, because otherwise our lifespan is going to become shorter and shorter.
Dr. Callender, screening for cancer, you say back to pre-pandemic, involves, let's say what? Because now they have so many Zoom with the doctors and
Your
you know.
telezoom does not give you a mammogram. Telezoom
Okay.
does not give you a pap smear.
Okay.
Telezoom does not give you a colonoscopy. Does not give you the PSA for the men for prostate cancer. So these are the things that you got to do,
I
and
see.
that is not taken care of by tele anything.
Yes, I understand. I was just saying they promote so much of the telemedical Zoom sessions, and maybe that's what people may be thinking. You know, my doctor and I are on Zoom.
Yeah, and that's why this article is so important. We've got to get back to what we used to do. And we did the Zoom because of the pandemic, and now we have to get beyond that and get back to our previously healthy practices, because an ounce of prevention is worth a pound of cure. And one of the things that is the Achilles heel of westernized medicine is emphasizing dealing with the disease rather than preventing the disease. So an ounce of prevention is what we ought to be dealing with, rather than dealing with disease treatment itself. Okay?
Yeah, thank you.
This is an interesting article. As a doctor on flights, I used to have a lot of situations in which I'd be on a flight and they needed a doctor. Now, not as much as it used to. And most of the emergencies aren't very serious, although there still are some. But they are so much better prepared now. They have the defibrillator, and they have all other equipment that allows them to be responsive. So that when they make that call as their doctor on board, they are very well prepared with medications, equipment that are helpful in terms of resuscitating patients who require resuscitation.
Dr. Callender, what is that? Is that syncope or
Fainting.
What is that?
Fainting. That means you faint.
Oh, fainting. Oh, okay.
Yeah. You lose consciousness temporarily. Right.
A lot of people-
Dr. Callender, I don't know how many doctors you're going to find flying on Spirit Airlines.
On what?
On Spirit Airlines.
Oh, I don't even know. I've never been on Spirit.
That's what I'm saying.
Yeah.
Right.
Yeah. Well, they have a nice in-flight toolbox, so that's good. And they also have a defibrillator as well. So
Okay.
they're well equipped. They're very well equipped.
I know they don't have any food.
Huh?
I know they don't have any food.
No,
Yeah.
Spirit is one of the cheapest ones you can have. You sit straight up and you have to pay for water.
Yeah. Really? Wow.
Yeah.
Spirit is that Greyhound bus in the sky. It just gets you to your destination. that and Frontier, and I can't remember the others, but that's, I mean, that's why it's so cheap.
Okay.
But I remember Dr. Callender, when I was on a flight with my husband, Charles, you know, I was sitting next to him and then I saw him sweating profusely. And I was like, what's wrong with you? And then, you know, he was like, I don't know, his lip was turning white and everything else. And I called the stewardess and I asked her for some orange juice. And, you know, once he had a little orange juice, he got a little better. And I was like, what is wrong? Anyway, he went to his doctor afterwards, but I was wondering, you know, what triggered that while we were in flight. I don't even know what you would call it.
Sound like it was hypoglycemia.
Oh, wow.
Is he a diabetic?
No.
Hmm.
No, he's not. But
Well,
I think he said he had something with his blood pressure medicine. They'd given him a new blood pressure medicine.
oh, I see. Okay.
And that was the only thing they thought may have done it. And they took him off of that and lowered it. But it was surprising. I was like, what is going on with you? I'm sitting next to him. He's sweating profusely and don't know what's going on with his body because he's normally in pretty good shape, health-wise.
Hmm.
But you weren't on Spirit, were you?
I don't know what we were on. I can't even remember. No, I can't remember. I can't remember, Miss Tatum, what we were on. I just remember the incident was so scary.
Hmm.
You know, being that high in the sky and like, okay,
Yeah.
you know, just getting sick like that. So I can imagine them saying, is there a doctor on board?
Yeah.
Mm.
If you didn't have to pay for the orange juice, you probably wouldn't have.
Right. So I must not have been on Spirit.
I thought this was an interesting article. They fined a nurse practitioner for calling herself Dr. Sarah,
Oh, yeah.
which I thought is interesting that you would actually find somebody for misrepresentation of the truth. Because a nurse practitioner is a nurse practitioner. They don't have a doctorate degree. But I thought it was interesting they would actually find somebody for calling themselves a doctor. I don't know. That is unethical. What are your thoughts about that?
What kind of things can a nurse practitioner do legally?
Almost everything that a doctor can do, including writing prescriptions. So especially in DC, because they have a license to practice medicine in DC, but they're just not doctors. But they have a board and they have everything else. But they just are not doctors. But they can do almost everything else. And the reason is because there's still a shortage of doctors. And so nurse practitioners are very necessary.
I know lots of times when I call for an appointment at my doctor, they will say the doctor's not available, but would you like to see a nurse practitioner?
Yeah. Becoming more common.
Yeah.
Mhm.
And as the shortage increases, it becomes even more common.
Mhm.
Is that cheaper? I mean, to get the degree, a nurse practitioner, doesn't
Yes.
it cost less money than a doctor?
Yes.
Okay.
But now a lot of nurses will get a doctorate because you can get a doctorate in nurses. So most people go on and get that doctorate. But a nurse practitioner is not a doctor.
So I have a friend who's a doctor, but he's a nurse. And
That's different because a nurse can get a doctorate and a nurse can go on and become a physician. So it's a question of whether the nurse is is an actual physician or has a doctorate, because there's a doctorate in nursing degree.
So you can't call someone that has a doctorate in nursing, you can't call them doctor?
Yes, you can. If you have
Oh,
a doctorate, yes.
okay.
Yeah, you just have to have the doctorate, that's all. Just like a PhD is a doctor.
Okay.
Yeah, so if you have a doctorate, yeah, you can be called doctor.
Yeah, now, that fine was exorbitant. But I guess the
I mean,
judge,
$200, that's not exorbitant.
I thought it was 20,000.
23,000.
Oh, that's exorbitant. I agree. Yeah. But I just think, I guess they're trying to make a point, I guess, that you should not, yeah, 20,000. You should not mislabel yourself. She's not a doctor, so, yeah.
Man, that 20,000, she could have gone to medical school.
Not really.
Not really.
Not really. Medical school is about $60,000 a year.
Mm, mm, mm.
Yeah. Now, this is something that we're dealing with, opioid crisis. And I think it's getting worse and worse. And of course, since the advent of fentanyl, well, fentanyl has always been around, but since the utilization of fentanyl, which is an anesthetic, opioid addiction and death are becoming much more common than ever before. 546,000 people died from opioid overdoses. That's awesome. And we've seen so many people dying from fentanyl. It wasn't bad enough for the heroin and cocaine, but now the fentanyl increases the death sentence. 182 people dying every day from opioids.
Dr. Gallon, I have a question about this issue. The overdoses, are they caused by the improper amount of the drug that the people take?
Any amount of fentanyl is improper amount.
Put those,
Repeat that, I'm sorry.
come back.
Any amount of fentanyl is an improper amount.
So that's what you're saying, is fentanyl has no medical purpose?
Oh, it does have a medical purpose. It puts you to sleep, but that's under an anesthesiologist's care. So you use the proper instruments, and so therefore, under medical care, there's a role for fentanyl, but not out in the street. Fentanyl is used to put you to sleep, and you monitor the patient and you intubate the patient and all of that stuff. But using it on the street is something else, and that's why they're talking about fentanyl test strips now to test the drug to see if there's any fentanyl in it. If it's fentanyl in it, then it's likely to kill you. Because fentanyl is not a drug that, not like heroin and cocaine, that the improper amount may be a problem. But for fentanyl, it's not appropriate, so it's likely to kill you. Of course, it also may make you feel good before you die, but you're likely not to wake up.
The other point, Doc, it's highly addictive. You know, people who try it once are hooked and can't stop doing it.
Same thing with cocaine.
But a lot less than with fentanyl.
Well, the difference is it doesn't kill you. Cocaine doesn't kill you like fentanyl does. So they got the dose is an issue, whereas with fentanyl,
they're putting fentanyl on everything now.
yes, that's right. Yeah.
Putting it on K2, they're putting it on marijuana, they're putting it on the crack, they're putting it on powder cocaine, they're putting it in heroin. And as soon as they do that and you try it, you have to keep coming back. So it's a horrible syndrome, horrible.
Yeah. What can we do? Because the problem is that when kids go to parties, you never know what they're going to put in the drug they're going to give you.
Just have to carry that antidote around with you.
Naloxone.
And I think this is before fentanyl test strips were illegal. And so now there's an effort to distribute fentanyl test strips, since any amount of it is not appropriate.
Mm.
Essentially, it only costs $1 for a test, so it's something that's easy to make possible. I'm sure all of us have had some experience with somebody who's died from overdose. And most of those people who die are relatively young ages. But this has been the scourge of our existence. Of course, COVID is pretty powerful, but opioids are approaching that. Any of you not know someone who's died from an opioid overdose?
My son.
No.
My daughter.
Well, this is an article that talks about sleep aids and how food can be a sleep aid. Melatonin, I think, is overemphasized in terms of its role in helping you sleep, although it's a natural hormone that's produced. This talks about magnesium and the fact that it affects so many different enzymes, and that it can also allow you to sleep well at night. Most people don't know much about magnesium, but every enzymatic process in your body pretty much uses magnesium. And muscle relaxation and nerve function is helped by magnesium.
Dr. Callender, what's the dosage for magnesium? I see the pills in the drugstore. I mean, how many milligrams, or how often you should take it, or before bed?
Well, I think most people who take it because they're deficient in magnesium. So you get it, and if you are deficient in magnesium, then you need to be on magnesium. But the disease which makes you problematic for magnesium is kidney disease, because the kidney eliminates magnesium. And if the kidney is not working, then hypermagnesemia is possible. But they identify the foods that are high in magnesium, which are good for you, like almonds, spinach, avocado, peanut butter, and also bananas. So that that's probably safe to take that. The dose they have here is 300 to 350 milligrams daily. But that is probably only necessary if you have a deficiency in magnesium.
Dr. Callender,
Otherwise, you're probably better off just taking food. Yes,
there's so many different types of magnesium. There's magnesium glycinate, magnesium oxide, and all those. Which one is best for me?
the one that works for you. Yeah, I think in my idea, magnesium is better for sleep than melatonin. But I think the product that gives you the least side effects is the one that's best for you. Because all of the magnesium products have some side effects. The oxide may cause diarrhea and other things. Yeah, so that the magnesium that you take that gives you the fewest side effects is the magnesium that's better for you.
Thank you.
And have you tried melatonin to sleep?
Mm-mm.
Yeah, it works for some people. Some people it doesn't.
My husband uses it.
Now, this is an article that is the scourge of the United States. We have more maternal and neonatal mortality than any other country in the world. And most recently, they looked at our preterm birth rates and found that we were among the worst in the world, giving us a score of D+, which is lower than the C- we had before. So we could at least afford it. This affects the Native and Black mothers more so than any other group. Native Americans, Black mothers suffer more than anybody else. Why is the richest country in the world associated with such situations? Something that we've got to work at harder. Because what is important is that when women are pregnant, they get checked by doctors so they can be followed and prevent going to preterm labor. And you see only 4 states saw a decrease in preterm births. That's not good out of 50, huh? What can we do about it? We've been talking about it for at least 10 years now.
Dr.
Well-
Callender, do you think the fact that a lot of women are having children older has anything to do with it?
I don't know, but I think it's more related to them not being followed by the doctors early. I'm not sure whether it's older or not. Older mothers is the answer.
Mhm.
I mean, for something to be that dramatic,
Mhm.
I think it has to be more than just
Just age.
older women. But I don't know the answer, but that's something to look into.
Mhm.
But you know, it's just been going on too long for us to be accepting of it. Now this article says that Asian women are having children older. I don't know about Native Americans or African Americans.
Mhm.
And I think we need to look into it and find out,
Mhm.
because it's not good.
Dr. Callender, if I would just take a wild guess about African American women, I would probably guess that theirs is very low as well. I
What do
mean,
you mean very low? It's very high.
Yeah, very high. Sorry.
Yeah. Well, and I think some of it may be caused by the coronavirus and people not going to the doctor. The pregnant women not going to the doctor as often as they should. But it's avoidable. And so if there's any place in the world we should not have this problem, it's here in the United States. Yeah. Any other thoughts on that problem about preterm birth and maternal mortalities? Well, anyway, the next article is hard to believe that we have come so far that we have twins born from embryos frozen 30 years ago.
Yeah.
Hard to believe,
Yeah.
almost inconceivable. But that's the nature of science today, huh?
Mhm.
What do you think about it?
Mm.
This is good for those people who want to wait until they're ready to have children.
30 years,
That's a long wait.
30 years, yeah.
That's a long wait. Wow.
Mhm.
Hmm.
That knocks my theory of age out the window, though, doesn't it?
Yeah.
Where's it coming from?
Wow. That's amazing. It's amazing with science. It's frightening with science what we can do.
Mhm.
Coming from?
Reminds you again of God's observation at the Tower of Babel in terms of what humans are prepared to do. Wow.
I didn't read very well. Whose embryos were they?
There's,
Sorry?
I don't know whether they were theirs or
It
not.
couldn't have been theirs.
No, because
No,
those
you
are
mean, what are you asking? When the embryos came from?
Yeah,
I don't know. All it says is it was on embryo donation. I mean, they don't identify. I don't think they are allowed to identify who was the donor.
but if
Yeah,
it's a
'cause I saw
they
donation,
used an egg donor.
Huh?
if it's a donation, it means it wasn't theirs.
Right.
Yeah.
because this was in the Washington Post, but I, scanned over it, but I kept thinking, where are they getting them from?
Oh, there it says their donor parents are an anonymous married couple.
That's what I thought, anonymous donor.
That's the way I think when you donate, I think they have a
Yeah,
pledge of anonymity.
yeah, you have to.
Would have been something if they were black twins, though.
That would have been nice.
Well, anyway, it's interesting what we can do now. The question is, should we be doing some of these things that we can do? In terms of exercise, there's the people who do all the exercise on weekends, and there are people who do the exercise every day, which is better. And I think most of the evidence is that it doesn't matter. In other words, if you do 150 minutes of exercise on the weekend, or whether you do it every day, it apparently doesn't matter. The positive benefits are equal. So I don't know which category you fall into, whether you do it on weekends or whether you do it every day. Seems like it's easier to do it every day, but that depends on your lifestyle. So. But it seems that these studies indicate that as long as you get the time in, it works. Whether you do it on weekends or whether you do it every day. So
Mhm.
it's up to you, whatever way you want to do it. You need to get the exercise. And if you combine it with weightlifting, it makes it even more ideal. In some ways, this article is deceptive because it talks about 5 tips to stave off dementia as you age. It talks about taking care of your blood pressure, taking care of exercising, avoiding smoking and drinking and all those things. And I think it seems like this is helpful, but to actually identify this as the 5 risk factors that actually prevent dementia is really saying a lot. And I'm not sure that the data really validate it. Although I would say that it's helpful, but to say that physical activity alone, but they're not saying it. They're saying, oh, these 5 things will help delay dementia or avoid dementia. But I just am not convinced that we can say if you do this, you will not get dementia. I think it curbs dementia risk. I think it's better. Taking the right diet, yeah. Okay, exercise appropriately, taking the right diet, yeah, helps, right?
Dr. Callender, on the group session in the past, we have talked about the mental exercises that help.
Well, I think they talk about that later on too, as well, because you're right. Mental exercise play a role as well. Controlling the blood pressure plays a role. Yeah. Smoking, we know, puts you at a higher risk for everything. Heavy drinking puts you at a high risk for everything, including dementia. They don't, and the bottom line is that all of those things together contribute to decreasing the likelihood of dementia. And this talks about the fact that there's some genetic predispositions that make you more likely to develop dementia. But I think saying that they could reduce the risk of dementia is a good idea. The fact that they don't mention the meditation and other mental exercises, I'm surprised that they don't mention that. They don't. Any comment about that article? Any other comments about the article? Remember the other article we discussed before going away said that dementia was decreasing over time. Anyway, I think it's accurate to say that those factors reduce the likelihood of developing dementia, but they don't eliminate its possibility.
Well, this leads us right into the next article because cutting down on stress probably reduces the onset of dementia.
Yeah, I agree, and that's why mental gymnastics as well as meditation play a role, because they keep your stress levels as they would call it at a manageable level. And this they talk about slowing your breathing, the yoga impact, among other things. And there's been much said about that more now than in the past. Muscle relaxation strategies. And then, of course, mindfulness, meditation, yoga, work. There's little, all the evidence now is clear that these three work, as well as medication. Exercise, we know well, helps. That's interesting. Journaling your emotions, which is an interesting way of doing it, to write about what you're going through, has a beneficial effect. Then a good laugh. It's always good.
Mhm.
Yeah, they say laughing is the best medicine.
Yeah, and of course, let's see, they don't mention music, but here again is we talked about that. Music is also beneficial. And then the practice of all those things consistently allows for de-stressing, which is easier said than done, but it's something that you can work at. Since we're all stressed, it's all a matter of how you choose to de-stress. Any thoughts on this? If not, this article talks about lab-grown meat. Since we talked about the processing of meat, and going now to lab-grown meat for human consumption. Of course, this only applies to chicken products. Well, getting closer to the market. It's not marketed yet, but it's likely to appear sometime in the future. It's interesting the way scientific knowledge is taking us into all areas. And I think it becomes even more and more important not to deal with whether we can do it, but rather whether we should do it. That's the question which remains to be addressed. The ethical issues relating to whether or not we should do some of the things that we can do.
When this becomes popular, I guess I'll become a vegetarian.
Well, being a vegetarian is helpful. Anyway, it's good anyway. So.
To me, it all depends on how it tastes.
I'm not willing to check it out and see.
Well, we're a little ways away from that yet, but it's coming.
There was a movie back in the 70s, Soylent Green.
Remember
Yeah,
that.
yeah, I remember that. Yeah.
When I first heard about this, that's the first thing that I thought of.
Yeah.
And there are more older people now. So that's another reason why it came to my mind.
And that was Edward G. Robinson's last movie.
Yeah.
Okay, what's the next article? Oh yeah, yeah. Omicron still driving COVID surges and worries. And of course, we got even more to come on this. So that while we talk about COVID being over, it's still here. It's still killing people. But you know, in a positive way, 80% of the population is vaccinated. You can look at that positive way. Say only 20% is not vaccinated. So that's better than the way it was. So we've come a long way, but we still should be closer to 100% if we can. And hospitals are being packed with COVID and RSV and the flu.
Dr. Callender, Mary Ellen is going to participate in a RSV study.
Oh, okay. What is it studying?
It's supposed to, it's supposed to be studying, the, vaccine. They think they got a vaccine that may be helpful.
Oh, I see. Okay. All right. And we don't have one, so we need one desperately.
Mhm.
Yeah, this is Tony Fauci's last year.
Mhm.
And he's had an incredible 50 years of work.
Mhm.
Tremendous job in his time. Been much criticized, but also much applauded.
Mhm.
Yeah, I know. I'm gonna miss him.
Well, we still don't have a director of the NIH, so we'll have two big positions we're missing. Right, his wife is a nurse, but he's done a lot, done a tremendous amount. We've reached more than 1 million Americans have died from COVID. Reached that number. Well, it's a new day. Dr. Johns is going to be the new person, so it's interesting how things have evolved over time. Well, we lived through an interesting era. Trump Fauci era. But you may wonder why Francis Collins has not been his position has not been replaced. But I guess it takes time to replace him, and it's going to take time to replace Tony Fauci. This is the new COVID variant. XBB. Yeah,
Mhm.
it's not fully here yet, but it's on the way. And the question will be, will the boosters protect us against XBB? And that time will have to tell us.
Hey, Dr. Callender, here's a new variant, but so many people now are just not wearing any kind of mask. I mean, everywhere I go, I'm like, there are more maskless people than those with masks.
I couldn't agree with you more.
Mhm.
I couldn't agree. And that's kind of frightening, isn't it? Yeah.
Yes.
So it's going to be a long winter, maybe. And the question really is, how protective are our boosters for the new variants? They'll have to study it and find out. It'd be nice if our the bivalent vaccines will be adequate for it, but we just have to wait and see.
So I have a question for Pearline. She's on the line. I don't know if she can hear, but my question would be for her is when the people come to the clinic, how do they screen them for the COVID virus other than checking their temperature?
This is an article that is ever important, is to keep the politics out of investigating the COVID origin. What he's saying is that Chinese are very defensive,
Mhm.
and if we go and ask them the questions without political overtones, you might get an honest answer. If not, they'll get no answer, or they won't tell the truth. So he said that it's important for us to have an open mind when we go in and be objective about it rather than subjective. So time will tell. It's going to be interesting because we still don't know the answer. No may we ever if we continue to take a political approach. Fentanyl scourge is seen everywhere, not only on the streets of Los Angeles, but on the streets of DC, Maryland, all over the world, all over the country. It's amazing how wide-ranging the homeless problem is.
Mhm.
And they have fentanyl highs as well as others. So. And for many, that sleep is permanent. Nearly 2,000 homeless people died in the city in Los Angeles. Crazy. Sad. Well, it's an interesting problem, but the problem of homelessness is an enormous problem as well. And mental illness in the homeless is an additional problem as well. 51% had mental illness. Wow. 46% substance use. Do we see that as much in Maryland? I think we see incredible amount in DC. Are you as conscious of it in Maryland?
Hussein Nemdi's daughter. WhatsApp audio.
I see a lot of panhandling, but I don't see them just sleeping on the streets like you do in DC.
Well, it's sad, very sad.
I know I'm familiar with somewhat. I've had students that were homeless, and in Prince George's County, they had apartments which you wouldn't know that they would be in, and they had security. But that's where I would see some of the homeless in actual apartments that Prince George's County's government is paying for, and that's where it goes. But as far as sleeping on the streets, like in DC, they have 10 villages in DC where the government gives them tents and etc. So I don't know and they also have apartments and etc. for DC.
Right.
So there's, but I see more people sleeping out on the streets in DC because some of them say they refuse to go into the facilities because of the crime and the diseases that are taking place in there. They would rather sleep out on the streets than on the inside of the facilities.
Yep, that's it. This is the article that talks about the increased risk of cardiovascular disease and death in middle age for people who like sugar, who like high white bread, low in fresh fruits and vegetables. So if we stuck to vegetables and fruits, we'd be okay. But the sugar sweetened beverages were thought to be as bad as the cigarettes, especially for the middle-aged. Of course, some of you are seniors, so. But diet is one of the better ways of living to an old age and eating the right food. And those sugar addicts and salt addicts are, and many of us are among them. It strains the cardiovascular system. And the question is how much exercise and how much weightlifting can overcome some of our dietary indiscretions. That's the question. And the other question is, should they? Should we just eat more healthy and live longer? And it's always interesting to hear some of these octogenarians, nonagenarians, and 100-year-old people who also have some of these habits that still live to old age. Black tea, talk about how black tea helps your health later in life. Essentially, we've also talked recently not only about black tea, but about coffee. But this article is about how black tea is good for you later. Many of you drink black tea?
I do.
Green tea.
Yuck.
Green tea as well. Apples, nuts, citrus fruit, berries, and more have the flavonoids. Black and green tea.
So regular tea is out, huh?
No, drinking black tea and green tea is good.
No, I mean just regular tea, not black or green.
Oh, it doesn't say anything about tea. It talks specifically about black and green tea. It doesn't say anything about just tea. And it looks like these are the ones that are most helpful. I saw an article recently about how grapes are so good for you. We've talked long about the berries, apples. So black tea was the study's main cause of flavonoids. Well, many of you drink a lot of the flavonoids but don't drink black tea? I think many of us do. What is interesting is that dark chocolate is also a rich source of flavonoids, but it's also a source of sugar. Now, this is probably one of the last articles, but this is an article that talks about more vaccinated people dying of COVID as fewer get booster shots. For the first time, the majority of people dying from COVID have been vaccinated. That's the first article that has identified 58% of COVID deaths in August were related to people who had been vaccinated. And one of the things that is even more frightening is not only that dying from COVID now, even though they're vaccinated, but also the group of people who are dying has been a source of concern. Because first it was thought that, well, it's well known that the elderly group was the group that died more from COVID. But with the elderly population being boosted, I think the next article actually shows that this is interesting, that 1 in 20 people have never had the virus, only 1 in 20. It's interesting. Yeah. Let's go to the next article, which I think shows that, well, I think Darryl had brought this up last meeting, that seasonal depression that occurs with the daylight saving time has resulted in so many people feeling seasonally depressed with the winter coming and the dark weather, that the mood is depressed. And so this is important to 25% had a negative impact. And so that this is still an issue of daylight saving times is leading to seasonal affective disorder. And that's something that we'd like to avoid. But however, politically speaking, that has not been the case.
Dr. Callender.
Yeah.
I think the last article tie into the one that we were talking about, purpose.
How so?
Well, you know, how you feel inside. Okay, I know the season may have an impact, but it goes back to having a purpose. If you have a purpose, you're driven towards that purpose. And it affects your well-being, no matter what season you're in.
Okay.
That's my belief.
Okay. All right.
I've got a comment about this too. Okay. Depression increases during holiday periods, particularly Christmas. There's a lot of pressure on Christmas financially to come up with the money for gifts, to participate in holiday activities. There's a lot of stress surrounding Christmas. And just a brief history about how we celebrate Christmas as we do. It really comes from the Feast of Saturnalia. It's a pagan holiday where you worship the god Saturn by gift giving and feasting. And so there's nothing biblical about exchanging gifts for Christmas. It all comes from the pagan celebration of Saturnalia. So I know it's a habit, people love to do it, but it's not really, it's increasing anxiety, depression, and stress.
Okay. It's after 10:30, so we better move along. This is now let's go to the one after this one. The one after this one. The next one. Because yeah, this is an article that points out that the pandemic is deadlier for the middle-aged than the first. First, we felt the elderly group was the one most hardly hit, over 65. But more recently, it's the middle-aged group that has been associated with higher death rates, age between 25 and 54, which is kind of shocking. And they kind of say that the reason for this is that the elderly group now is almost 90% of them are vaccinated. And the group in the middle-aged group, 25 to 54, aren't as profoundly vaccinated as they are. And so that they were surprised to find that the biggest increase in mortality was in the middle-aged group. And that's a group that we felt was protected, but apparently it's not. And so this is your children, and yeah, so as we talk about the maskless groups, we need to remind them that they should be fully vaccinated if they can be. So, and especially since the death rate of COVID is still there. But the more fully vaccinated you are, the better off you are. Any comment about this one? I think this should be the last one because it's almost 10:45.
I agree with you that we older folk have paid attention and gotten our shots, where the younger people, a lot of them don't think they need them, or they wait later.
Yeah.